do you intend to award?
Up to 7 if there are 7 that meet the requirements and are sufficiently innovative. There is funding for up to 7.
We also, of course, reserve the right not to fund any if there are not sufficient of the standard. And we also could, if there were promising ones that don't quite meet the mark, have a process of trying to bring people together or whatever. If there was a shortfall. So, but if we get 7 applications that meet the mark, we can fund 7.
Is there another live question?
There is.
Oh, sorry, online.
This comes from Ellen. You briefly mentioned the Primary Healthcare Research and Information Service, also known as APHCRI. How do you see APHCRI working with APHCRI and the CREs?
One of the details we didn't really go into was what we have done with the first 3 and when the next group are announced. We have formed an APHCRI CRE network, and on that network are the chief investigators of the funded CREs, plus departmental nominee, plus the nominee from APHCRI, the Primary Healthcare Research Information Service. So APHCRI is an integral part of the CRE network. Their key expertise is knowledge exchange, and so they're integral to the whole process. That's not the only link we have with APHCRI, but in terms of CREs, that's the formal linkage of this network. But the detail of that really is once we get the CREs, people will be dragooned into invited to join the CRE network.
You hold it, okay. Bob, you mentioned a bunch of outcomes that you're really interested in, and the most important one you said was developing relationships. Now, that was relationships with people in Doha, or who?
Well, obviously, if we don't develop relations with people in Doha, I think we'll fail the test. But I think it goes beyond just developing relations with people in Doha, and other stakeholders would include what I call the NGOs, national bodies, which could range from professional associations to disease-based groups, to bodies like AGPN and so on and so forth. So I think, and of course consumer groups. So we don't want to say you've just got to focus on building relationships with Doha. You build relationships with people who are involved in the policy process around the area of research you're undertaking.
So from a sort of hard-nosed point of view, if you're like, when I'm writing an NHMRC grant, they ask, what are your policy achievements? Yeah. And I find it really hard to know, how do I make it visible, all these relationships that I'll be developing with the CRE that I go for? Do I just put down, I had a chat with so-and-so, and that's the outcome? How do you solidify all these relationships that you have?
It's probably more than chats, I would think.
And other sorts of demonstration.
Yeah. A good example would be advisory committees that CIs or others on the grant are involved in. Or it could be participation in policy processes. So sometimes the department will convene, or other groups will convene a national forum to discuss a policy process. It could be an ongoing link with a particular policy group, be it a state government group, a federal government group, or a local community group. It's demonstrated actual activity. Now, whether that results in a change of policy, I defy anyone to link that. So we'd love you to be able to say, well, we actually, changed the policy around X, but I doubt very many people will do that. And if they said that, we mightn't believe them anyway. So
that was the final part of my question. The whole point of this exercise is the relationship between research and policy.
Yeah.
But I've always been really worried about, what do you mean by change of policy? I mean, have you ever seen an example of where people have done, in primary healthcare, have done research, and then they can say, oh, there's that policy down there, and it's directly linked to our research?
The only example I've ever seen of that was a policy that failed. We're not looking for that. I think that's in many ways that's a researcher's view of how policy works. It's serial and it follows logical steps, like of course research does. But it doesn't work that way. So I would be suspicious of anyone who says, well, we did this body of research and bingo, it became the policy the next day. And it worked. So it's more about the relationships than about the outcome in the sense of proving you changed a policy. Because I just don't think it's as simple as that. And it'd be very hard at the end of this to demonstrate that we've changed policy.
So we shouldn't attempt to do it?
No, we should attempt to inform policy. And our relationships will be examples will be how we demonstrate that we've helped inform policy.
Okay, we have a question from the web audience, please.
Thank you, Dagmar. We've got a question from DM. Previously, there's been a requirement for there to be collaboration between those funded by APHCRI and an APHCRI naive group. So, previously funded, I should say. Does this requirement still stand?
The premise of that is incorrect. There was never a requirement that there be a previously APHCRI funded group in a proposal. It was at least one had to have not been funded by APHCRI, but it was possible for the whole team not to have been funded by APHCRI, but it was not allowable for the whole team to have been funded by APHCRI. That rule hasn't changed, so it's incorrect to assume. The way we worded it was to make sure that at least one team had not been funded by APHCRI, but that didn't mean the other team or any other number of teams had to have been funded by APHCRI.
Is there a question from the floor? Okay, we do have another web question.
Okay. We've got a question from John, looks like Management ACU. Just for the idea of general competitiveness, it's a two-part question. How many applications were received last time? And the second part of the question is, what was the amount funded as a percentage of the funds requested? I'm not sure if
I understand that.
Yep, okay.
There were 27 applications last time, and there were 3 funded. I don't have the information about what proportion that is of the budgets that were requested, but the 3 were funded at $2.5 million each over 4 years, and that's really all that matters. We don't fund a proportion of budgets, we fund a fixed amount for each CRE, $2.5 million, and if they ask for more than $2.5 million and they're successful, they still only get $2.5 million. So the question of proportion of funds asked for is not relevant.
Okay, there's nobody from the floor. Is there another online question at all, Will?
Okay, so follow-up. I might just, he had a follow-up, John, Management ACU, so he said, just noting my question, I'm aware of the differences / changes since the last CRE round. He said his question was just about, just after getting a general idea of the competitiveness. The next question we've got from Anne Dadich. To leverage existing capacities and reduce, if not avoid duplication, what opportunities are there to develop external governance arrangements between proposed and existing CREs?
Did the people in the audience hear that question well enough? Thanks.
Do I need to say that again?
Yes, please.
So from Anne Dadich, to leverage existing capacities and reduce, if not avoid duplication, what opportunities are there to develop external governance arrangements between proposed and existing CREs?
I'm not sure I fully understand the question, but first of all, the requirement is that each CRE have a governance structure for that CRE, and there's, the information about those is in the package of material. So they need to comply with that. If they wish to form links with existing CREs, there's no restriction on that occurring. However, there is a rule which I alluded to that a chief investigator of an existing CRE cannot be named as a chief investigator on a successful bid for round 2 CREs. I mean, they can be named, but if they are, the thing will be ruled invalid. So I'm not sure if that answers the question. If not, perhaps they could send a follow-up email or whatever. Yeah.
Any questions from the floor? Yes, we'll take yours.
Question, John.
It seems to me that there could conceivably be a tension between the sub-themes and overarching themes and the desire of some primary healthcare researchers to focus on a particular clinical area. I notice that mental health is a clinical area that's mentioned in the document. Is it possible for researchers to look at, say, a particular area of chronic disease and apply the sub-themes and overarching themes in that area and still be regarded as competitive in this application round?